This is the Conscious Mental Health Podcast for curious clients and conscious clinicians. This podcast is for informational purposes only and should not be considered health or mental health advice.
Well, welcome everybody to the CMH podcast. I'm Laurel. I'm a licensed professional counselor and a mental health educator.
And I'm Juniper, also a licensed clinical social worker and mental health educator. And guess what? We are here today with a guest. And that's been a while since we've had a guest on the pod tube.
It has. It's been a little bit, and I'm really excited because I've missed it.
Before we begin today's conversation with our guest about fertility, we want to acknowledge that reproductive health is a deeply personal topic that intersects with many aspects of our lives. These subjects can be viewed through various lenses like medical, religious, spiritual, cultural, and political, and can invoke strong emotions or be connected to personal trauma for many listeners. The perspectives shared in this conversation with our guest, Shelby VanCleve, represent her professional experience as a fertility coach and licensed acupuncturist, but do not necessarily reflect the views of our podcast or host, and is definitely not intended to be medical advice. We believe in exploring diverse approaches to topics relevant to mental health and well-being, and we invite you to engage with this content in whatever way feels right to you. If discussions about fertility challenges, reproductive health, or related topics might be difficult for you, please practice self-care while listening, including pausing or returning to the episode when you feel ready, or even just skipping this one. With that in mind, we're excited to welcome Shelby to discuss her holistic approach to fertility that kind of bridges Western medicine with alternative therapies. In this conversation, we talk about the importance of comprehensive sex education, addressing male factors in fertility, mental health support during fertility journeys, and practical resources that might benefit those navigating these highly complex waters.
So we will introduce our wonderful guest now. This is everyone, Shelby VanCleve. Shelby, welcome to the Conscious Mental Health Podcast.
I am a fertility coach and a licensed acupuncturist, and I am super passionate about teaching women about their bodies and walking with them on their journey to motherhood. And so I'm really excited to be here today and share with you guys more information about that and to talk about how I can support mental health practitioners as they support these clients walking this path as well.
Yeah. And we're so glad to have you because I think this is something that, I know for sure this is something that is a specialization and niche I did not get any training in my graduate schooling, or even really much in my postgrad work. And so I also know that it's becoming more and more of a need and more of a topical issue for a lot of folks. And we're really glad to have your expertise because I think it's inevitable, and we'll talk about that, right? That this is going to affect all areas of our being when we're walking through a fertility journey, including the mental health realm. And so it's going to be really great to hear your thoughts on how mental health professionals can support folks going through all of that.
I say this all the time. We should have been taught this stuff in health class, but instead we were taught, fear that we could essentially get pregnant by sitting on a toilet seat that had sperm on it, or that if we had sex, we were going to end up with AIDS, and the truth of the matter is conditions have to be absolutely perfect for you to conceive. I have a daughter who's 9 and we talk. And my son, when he started being sexually active, I was like, this is your responsibility, son. You need to make sure that your partners know about their cycles. And they can always talk to me about it. But you're the one that is actively preventing pregnancy, not them.
What a wild perspective compared to your point, what I was taught growing up.
Yeah.
Because that was definitely not how it was framed to me. And I remember being afraid of things like getting pregnant from sitting on a toilet seat or in a hot tub or, fill in the blank,
Yeah.
because no one ever taught me anything other than you're going to have a period and don't have sex or you're going to get pregnant. Those were like
Right.
the two things.
Yeah. I remember my parents leaving a book in my laundry basket that was describing about, body parts and sex and all of that, but never talked to me about it. And what I did with my son, who's now in college, is I bought him a book and I said, I want you to look through this book. And in 2 weeks' time, we're going to sit down and have a conversation about it. So I wanted him to have some information beforehand so he didn't feel just like totally blindsided by the conversation. But I am going to force you to sit down and talk to me about these things so that we're all on the same page. And that's just a boy, and he was definitely most interested in learning about the women's cycle because it's more complex than what his mechanics are.
Given all this experience that we've been sharing about our own story, I'm curious how you went from that book in the laundry basket to having those conversations with your son in a very different way, and how you came to doing this as like your work as well.
Yeah. So, it it was definitely an organic evolution. It wasn't like something that I knew that I was going to do, from an early age. The long and the short of it is like, my childhood wasn't easy. In mental health terminology, I have high ACE scores, adverse childhood events. And, that and lack of family support set me on a trajectory to figure out my own healing path. And I started with that pretty early. Lots of stumbling blocks along the way, but started meditating in high school. And I also grew up with a lot of conflicting religious information coming in. And so it made me really have a lot of existential questions and kind of jumping back and forth in between different religious ideologies just caused a lot of confusion. In college, I didn't know what I wanted to do. And so I was in an anthropology track, which is lovely because you learn about other cultures and different ways of looking at things and ways of life. And that's when I found my first book on Eastern philosophy, which is the framework for Chinese medicine. And it was like the heavens opened up and the angels sang. It all just made so much sense to me. This like rhythmic, seasonal, nature-based balance between our bodies and our natural surroundings. And because it just felt so aligned, it encouraged me to walk that path. And so I decided to go into acupuncture school by about age 20, which is kind of early to figure that out. Most people in my schooling were in their second careers, like they'd had an amazing experience with acupuncture and it guided them to become an acupuncturist, where it was Eastern philosophy that pushed me in that direction. And I really chose that line of work because I wanted to force myself into a framework of self-development. Like I knew I needed that structure to really do the thing. And it couldn't be like a hobby. I had to fully immerse myself in it to like pull myself out of this trauma. And it's still a work in progress, right? Like healing never stops. It's very circular. So, I went to acupuncture school, and about after 5 years of practice, that's when I actually moved to Louisville, Kentucky. And fertility patients kept walking through my door, and they were so many of them so broken, so lost, so helpless. And my heart just broke. And I'm like, I got to figure this out. Women's health, hormonal cascades, like we learned about all of that in both undergrad and my graduate work, but it just bounced off my head. Like it's complicated. Like it didn't sink in. And so I really had to make the commitment and like stick my teeth into it to really figure it out. And so, since then, educating women about their bodies has become my passion, because it's, like we talked about earlier, it's so often overlooked. And it is just so cool to help women bring life into this world. It's incredibly gratifying work. It's hard work. But the final product, the end product is just you can't beat it.
For you, I think one thing that we're going to talk about a little bit as far as like you have developed courses for women as well and for mental health practitioners too to understand this better for themselves. But how do you combine your background with probably these folks who are coming in who are undergoing like all of these what we might like term as like Western medical treatments, right? So it's more of like a holistic perspective. What does that approach look like to combine your knowledge base with what they're experiencing in all of these other appointments and like all this other advice that they're given? How do you work that and navigate that?
Well, I feel like the most important thing is you have to honor where that person is at. If they have choose to walk a path in a certain way, you can't poo-poo that. It may not be what you would do, but you have to honor where they're at. And so you can't make a judgment, oh, you should, do it this other way or do it the natural way, or you've got to hold space for where they're at. And when we talk about holistic fertility, which is basically what my courses cover, holistic, obviously means whole. So we're going to look at all aspects and treat all aspects and allow all aspects. And so they're not mutually exclusive. You can be taking hormones and having surgical procedures done while also meditating and exercising and eating well, getting the proper support through your mental health practitioners support groups. It's not one or the other. I am very much not this is the only way or a cure-all. I feel like that's kind of playing God. And I think doctors do that a lot, to be honest, but it takes, our bodies are so complex. Our experiences are so complex that to think that there's one solution, to me, is very short-sighted. And so, when folks come into my office, we're going to look at their medical history. We're going to look at their current concerns, their hopes for the future. We're going to look at their mental roadblocks. We're going to look at illnesses and infections, toxic exposure, hormonal symptoms, digestive complaints. And we're going to assume they're all interrelated instead of isolated incidences. And unfortunately, conventional medicine has gotten so specialized. They're just looking through these tiny little, frameworks that they often miss the bigger picture. And I do want to just say, I don't actually like the word infertility. I don't fully believe in infertility. I believe that we have fertility struggles. Fertility is really a state of being. It's more about body awareness and deep nourishment than it is about diagnosable pathology. And, there is that piece, especially historically. It was women with PCOS, that like never had a period, never had kids. These days it's different because we just live in a different environment than we did ancestrally. And so, that's a little segue, but, the fertility practitioners, the OBGYNs, the primary care doctors, they're educated on surgery and medicine, surgery and pharmaceuticals. And so that's their training, that's their scope of practice. And so you can't expect anything beyond that because they didn't receive anything else beyond that in school. They just would have to spend their own time to figure that out. And as we all know, doctors are seeing patients every 15 minutes and they just don't really have the time to figure that out. And so, the holistic approach is multifaceted. And it comes from, illness is both inside of us and outside of us. And so, you need multiple practitioners often. You need your therapist, you need your fertility doctor, you need your massage therapist, you need your acupuncturist, your fertility coach, whatever it is that suits you to address all aspects of your wellness in addition to your fertile wellness. I always tell patients it's like peeling away the layers of the onion, and it takes a while for us to really get to the heart of the matter. And once we figure out what that is, then we put you back together, piece by piece to create that whole again. I don't I don't poo-poo Western medical intervention. It's got a time and a place, but I don't think it should be done in isolation, hardly ever. Unless, you break a leg. And even in that, I'm going to be like, yeah, you need some Chinese herbs and some acupuncture too.
I mean, I think that that is like a view that, I mean, I don't want to speak for Juniper, but I know that we, in our practice as clinicians, really try to see things from like a whole person and a like systems based perspective. And so we run into that, or we have had those, I think, interactions and situations where it can be the same in mental health too, that it can get really siloed and just like really like focused on a medication or, this one diagnosis. And so I think that to me, that sounds very familiar, just in a different realm. But it is so interesting to think about how that is just sort of presented as what you do is you go to the doctor, which is again, like I'm not mad at a doctor. Like, please, that's not my job. But it is just fascinating to me that that is, kind of the world and the culture we live in. That it does get so
Right. And one of the ways that we appreciate looking at integrative, like using the integrative approach, is that, yeah, it's not one or the other. There's not like, hey, all you have to do is drink juice for 4 years and that's it. Just drink juice and coffee enemas. It's like, okay, like you said, if that was the case, this world will be a different place, right? Like there's so many factors. And so with integrative, there's this sense that you're combining complementary and traditional, if you want to call it that, medicine. And so like that you have any level of combination of all of those things that are helpful for you. And then there's other things we can't control, like society, politics, the environment. There's so many things that go into it, Shelby. And I really appreciate your approach of saying meeting people where they're at. I actually had to write that down because that's definitely something in therapy that is an important component of meeting people where they are. And I think especially for women in particular, at least my experience as a white woman, that there's so many messages that we get about doing things right and doing things wrong with our bodies, and our bodies are political. They've been politicized, they've been controlled through laws like Roe v. Wade and different things like that for I don't know how long, probably forever. You were studying anthropology, so you probably have a good idea of that. But there's something that can be unhelpful when practitioners come in with very specific views, and that can almost kind of play into that idea that we're doing something wrong or right. I'm just curious from your experience of working with the population that you do, that they've already absorbed so many messages about what they're supposed to be doing. And like you said, from the medical perspective, from even and then there's so many different perspectives of the exact approach you should take. Say that you're experiencing, and you said you don't like the word infertility, so I'm not sure, but you're experiencing difficulty becoming pregnant and you want to be pregnant, something like that. And you're getting all these messages. I mean, you can just turn on Instagram and probably find 5 different things that people are telling you that you should be doing. And so I'm curious from your perspective of when you first see someone and they come in.
Yeah. Well, the primary thing that I see with women is a great sense of shame that they're unable to fulfill their evolutionary biology and reproduce. And so they already feel like they aren't able to follow their destiny. And then they're hit with a barrage of all the things that they potentially did wrong to negatively impact that, whether that is taking birth control instead of addressing their period problems, which is, not their fault. It's the fault of their OBGYN or their PCP for saying, oh, you've got cramps. Oh, you've got irregular cycles. Just take this pill that masks it but doesn't fix it. And then they're left to deal with the fallout whenever they come off said medication and want to get pregnant. Of women that struggle to get pregnant fall into the kind of classification of a type A person that is super productive and normally like is able to get what they want through sheer force of will. And so they think they can do this for their reproductive health as well. Well, if I just, you know, take these supplements and exercise this way and eat this way, I can force this child into my body. But fertility is more of a state of being in rest and softness and receptivity than it is of grasping and tension and forcing something. And so, we're fed all of this, almost, that you can do better, you have control of this, which there is an aspect of that. I do truly believe in empowerment and body autonomy, but that puts a lot of weight on women's shoulders that already have a lot of weight on them. I'm kind of irritated with the whole, feminist empowerment movement where we, stepped outside of the house and started working in our careers, but we didn't let go of the household responsibilities. And so we have 2 full-time jobs, in addition to, if you're going through fertility treatments, like, it's extremely time consuming. You've got lots of doctor's appointments. There's a lot of pressure to perform because it's financially intense. And so there's only so much one woman can bear on her own. But even just mentally, emotionally, physically, all of these things compounded are just impossible. No woman could do this. And so, it's a social construct. It's pressure we're putting on ourselves. All of us can relate to that, I'm sure, to some degree, whether we're trying to get pregnant or not.
As you're talking, I'm just thinking about, it's just so interesting, that juxtaposition of, I have been like on Instagram and seen, oh, well, like, you should be doing these things are killing you, or like killing your biology, or like ruining your body. And so you should be doing. And, it's not 100% incorrect. Like, our system and our world in many ways, I think, is set up to be harmful at this point. Like, we're exposed to so many things. It's so high stress all the time, but yet it's this individual response. It goes back to this individual responsibility still and because of this, now you have to do this other thing, and don't forget to do that thing, and don't forget to not do that thing, and you did this thing wrong. And so even a lot of times I notice that even in an attempt to think more holistically, it still comes back somehow to the individual being fully responsible for all of this, and it's all on their shoulders. And how could that be? First of all, it's not correct, but also, how can that be manageable for any one person who's trying to navigate all of this? It's just not. How do you find people respond to that? Like, when you have those conversations with the people that come and see you that are in the midst of that journey? Because I hear that there, of course, could be a lot of shame. And I'm curious how folks respond to that, like, sort of mindset shift is very different from what most of us are hearing on a day-to-day basis.
Yeah, I mean, intellectually, it makes perfect sense, so I can say it, and my patient will hear it and understand it, but to embody it is a totally different thing. And for that, it takes fake it till you make it. You just have to put one foot in front of the other and pretend like you understand what I'm talking about or how to do that thing, but just slow down. Don't push through the exhaustion. Don't shit on yourself all the time. If you don't feel like doing the thing, don't do it. And I struggle with that. I work on that really hard every day. I don't feel like getting up from my chair right now, but I need to do XYZ. Well, you know what? I'm just going to sit in this chair right now. And it's so much harder to do in my house. That's why I love camping so much, because I can do that well when I'm in the woods. I can just sit in my camp chair and stare at the trees. And it's the only time that I'm not I'm stimulated by the wind and the leaves, but I think that's a better stimulation than what most of us are getting on a daily basis. So, going back to that discussion about conventional and holistic integration, we have to address both at the same time. I think at this point, everybody has an understanding that they need to have a good self-care practice. It's been such a, catchphrase for a while now. But to put that into practice and in a relatable way is super individualized, but incredibly important, because that is how you make the space. And then we get kind of caught up in all the things that we can do. But when I sit down with clients, I tell them, I'm going to tell you all the things that you could be doing for yourself. And I'm going to tell you what I'm going to do for you. And I'm going to acknowledge that all of this can't be done. But I don't know what pieces are going to resonate with you and what is not. And I'm going to trust you to know that and to be able to communicate that with me. And we'll just go from there. But these are the options. These are the ideas. And pick two that resonate with you. And we'll circle back to some of the others in the future. Because I don't proclaim to know what the best answer is for any individual. I just have a lot of ideas of what I think can work and what I have seen work.
And as you're talking about that, I of course, I'm connecting to what is or what could be like a therapist's role in this, as far as how we can offer support within our scope of practice. Because, a lot of our listeners and our viewers are in the mental health realm. And that maybe is not all encompassing, but sounds like it could be a starting point of reiterating some of those conversations. Like, you don't have to do all of the things. Like, let's talk about all the things you're hearing and figure out what is doable for you, because I think sometimes there can be a shutdown, right? Of like, everybody's telling me I have to sit down and stop and not, but then there's all this other stuff that I am supposed to be doing. And that feels totally impossible from a logical perspective. And so I just kind of shut down. Right. And so just helping review those conversations that you might be initiating with your patients, as a support of, hey, remember, we're hearing all these things. Where is a percentage point we could get to for you? Or, what feels doable for you at this point? And it doesn't even have to be a tenth of those things on that list, if that's all you can do, kind of helping ease folks in to those mindset shifts potentially. I'm curious what your thoughts are as far as the mental health support, or the way that mental health professionals can help with this big idea.
The first thing I want to say about that before I go into more detail is, it's kind of an important thing overall right now, but you've got to pay attention to your sources of information. And so there's a lot of noise, and not all of it's untrue, although facts are hard to ascertain these days or to compare. That's where I come in, as a fertility coach, as I kind of cut through the noise. And I encourage folks to lay off their use of social media and what I refer to as the forums, which are, Reddit and Quora and all these things online, which can be really helpful, but you're going to get so much information about women's terrible experiences, what worked for them, what didn't work for them, judgment. Pay attention to your sources. And this plays into the answer to your question about, what mental health practitioners can do here. The hormone system, which is our reproductive system, and the stress hormones system are the same. And that's known as the hypothalamic pituitary adrenal axis. And sometimes we call it the hypothalamic pituitary ovarian axis. They're very interrelated on a biochemical level. But instead of going into, the hormonal details, I would just say a simple way of understanding it is thinking about our evolutionary biology, in that when we're under constant stress, real or perceived, and that's the piece that we'll talk about with sources, which we have come to call, fight or flight. All of our resources are shunted to our muscles for a quick getaway and to our brain for quick decision making. And it's going to shut down what they call our rest and repair functions, which is digestion and reproduction. When you're running from the tiger, it is not the time to have a baby. When you are in times of famine or poor nutrition, that is not the time to have a baby. That baby is not going to survive. And so our evolutionary biology shuts down our reproduction because it's not a safe space in which to reproduce. So, our bodies don't know the difference between real and perceived stress. And so when we're taking in negative constant stimulation, whether that's the news, but also like dystopian future Netflix series and, psychological thriller fantasy, plus the real stressors of our actual life, like traffic and, husbands and busy schedules, and finances, like it's all too overwhelming for our systems. We aren't, they call it evolutionary mismatch. I don't know if you guys have heard this phrase before. Just like our bodies haven't caught up to deal with all the constant stimulation that we're getting. It doesn't know the difference. And so it sets off the stress response. And we're constantly either in the super high cortisol or super low cortisol state, depending on where we're at in our burnout spectrum. And this directly interplays with our hormones and reproductive system. And so, and then you can add in additional mental health struggles like trauma, high ACE scores, chemical imbalances, addictions, anything that you all deal with on a regular basis. And that further causes imbalance to this HPA axis. And so, in my opinion, mental health practitioners play a huge role in helping guide their clients back into their bodies, into a state of homeostasis in a place that is much more conducive to conception.
I love this idea that you talked about, which was like a menu of options. That's what I thought about it in my head. I'm like, oh, that's a menu of options. Yes, because that way you can say, I'm willing to try this one at where I am right now. And speaking of how you're working with people, when they're coming into you, they're typically what are they experiencing? Difficulty conceiving, I guess, is that what you say? Or are they someone, for example, that are in a same-sex relationship and are conceiving through fertility methods that are medical? Like, what is the range, and where do you find people coming to you as a source of support?
It's the full spectrum. I have supported almost everyone except for male same-sex couples because they're going through surrogacy, although I do have a surrogate currently in my practice for male same-sex couple. And so, but those gentlemen are not going to be seeking treatment. But I have had women same-sex couples. I have had single women who are using donor sperm. I have the vast majority are heterosexual couples that are having difficulty conceiving naturally. And they're either wanting my support for natural conception, or they're wanting my support through fertility interventions. But, I've worked with donor women who are freezing their eggs. It's the full gamut. And that's what makes it interesting. There's a lot of overlap. And so I feel like I can effectively address pretty much all of it. First of all, I'm super clear with people about what we can and cannot achieve in the time frame that we are given. And so the research on whole systems Chinese medicine, which is differentiated from acupuncture in that whole systems Chinese medicine includes diet, lifestyle, herbs and supplements, self-care, referrals, as well as acupuncture. So the holistic approach. The research is 9 to 12 treatments prior to trying to conceive or trying for an IVF or fertility treatment cycle. So that's weekly treatments for about 3 months. And so if a patient calls me and they're in the middle of an IVF cycle, I will tell them, I cannot impact this cycle. We cannot impact this cycle. This cycle is set. I can walk alongside you. I can guide you. I can help with stress relief. And God forbid, if this cycle does not go well, then we have a plan moving forward. But I'm not going to kid you into thinking that I'm going to be the magic bullet for this cycle. I think that's a disservice. And so I will tell people that, I ask for 3 months, and often it takes longer than that. But if you continue the diet and lifestyle and self-care interventions that we talk about in the treatment plan moving forward, and the other note about that is, my initial and my first follow-up are really intense appointments, because in the initial, I ask you a whole bunch of questions and make you think everything in the world is wrong with you. And then in the first follow-up, I tell you all the potential things that you could do to help yourself. So it's a lot, with that caveat, you're not going to be able to do all of this, but my hope is that just by giving them the menu of options, that even if they choose not to continue with me, they still know what their options are moving forward. I don't want to withhold that information and just dribble it out over time. And so I give it to them all up front, for good or for bad. And then, like I said, circle back to it and expand upon it in more detail. But, mostly if they're coming in, I get a lot of calls like a month before they're going to go through IVF. And I tell them the exact same thing, the eggs that you are going to retrieve in your IVF cycle were called into recruitment about 6 months ago. And between 6 months to 3 months ago is when those eggs made their decisions about if they were going to be good or bad based off the information that they had surrounding them and their follicular fluid. So they have sorted their chromosomes, their destiny is set, but it's set within that 6-month time period, right? So you do have this impact in this time period, but once we get past that, we're not going to make much of an impact. And so even if, a client sees me for, 3 to 6 months, and then they discontinue care, and then I hear from them 6 months later that they are pregnant, we did that together, even though they weren't in my office, they were still doing all the things that we worked on, and the work that we did with the acupuncture in terms of increasing blood flow to their pelvic organs, that impacted their egg quality. And so it's just, the time frame is frustrating, but it is the truth. And I don't downplay it at all.
Yeah. And as you're talking, I keep coming back around to, and I was thinking some of this same stuff as I was going through your course, just the sheer length of time that so many people have to devote and commit to in these processes. And while it might be kind of it is what it is, like this is how our bodies are built, this is what we are working with, I think, especially in the social location that we occupy and just kind of the way our world works, that could seem like even bigger to a lot of people who are really used to like instant. And I'm speaking for myself too, like that feels like a really long time. So much of this process, even one cycle of IVF, or, even just having to wait even each month to kind of figure things out and know where you are in the process and what's happening and get answers. I could see being really, really a very difficult component of this. And so I'm curious if you have thoughts on how, as mental health professionals or therapists, like we could be supportive in helping with that waiting game. Other than just saying, yeah, this is hard. You're waiting a long time. And maybe that's all it is. But it just seems like there could be so much even potential for like grief. And God, I'm like missing this time keeps passing, this time I'm losing all of this, like as I'm waiting and waiting and waiting. That just seems like incredibly difficult component of the process.
Yeah. I often joke that the fertility treatment, Western fertility treatment intervention is a whole lot of hurry up and wait. You know, you've got to get all of your stuff together, you've got to do all of these things, and then you just have to sit and wait for either your doctor's appointment or the dreaded 2-week wait, which you have probably heard about, once you ovulate to when your period will start again or whenever you have a positive pregnancy test. And, you know, there's no good answer besides just being diligent with your self care and honestly, distraction. Because, you know, and I get the questions all the time like, what can I do to make this pregnancy stick? And, you know, again, it's like that cascade's already been set. You know, that was set in the follicular phase of your cycle and in the months prior to this. You know, once you've ovulated and you're in that 2-week wait, there's no amount of pineapple eating or red date eating or nettle tea drinking or, you know, legs up the wall, you know, not, yeah, no, you know, like this is just the waiting game. And what I encourage women to do is just assume it worked. Because we try to trick ourselves and pretend that if we don't get our hopes up, that it won't hurt as bad whenever it is not successful. And it's just not true. You're going to be just as upset, just as grief stricken if you spend that 2 weeks going, well, I'm not going to get my hopes up. This probably didn't work, you know, versus like, ooh, this could be it. I could be pregnant. You know, you're going to cry the same when your period starts. And so why not assume the best and hold that positive energy for that soul to drop into, which I know is hard. But the alternative is to walk around negative all the time. And I know it's easier to say than to put into practice, but I'm often asked, like, you know, I'm worried about getting my hopes up. Is that, you know, and I'm just like, get your hopes up because you are anyway. You're just lying to yourself saying you're not, you know, so embody that. Um, and we'll deal with the fallout when it comes, as it will inevitably come either way, you know, but you just get so accustomed to disappointment and grief that you just spend your life in preparation for it. You know, and on that note, you know, I kind of want to segue a little bit and talk about some of the emotional components that we deal with in the fertility struggle. And as we kind of we've touched upon shame and grief, you know, there's also an incredible amount of comparison. And so we hear all the time, you know, it's not fair. Any kind of comparison culture, which we're so indoctrinated into at this point with social media. I miss the days of just Vogue magazine, right? You know, just looking at these picture perfect models versus like real life women that are picture perfect. I mean, it's easier to anyway, that's a whole nother topic. But this comparison culture piece is terrible. And they do it with their family members as well, you know, and their friends. You know, it's really hard to hear about other people's pregnancies when you're trying so hard to get pregnant yourself. And then, of course, there's a lot of fear. Yeah, fear of the unknown. You know, what if I'm never able to have a child? You know, what if I'm never going to be a mother? What if my partner doesn't want to be with me if I can't provide a child for them? What if this procedure that, you know, I'm about to pay $30,000 for does not work? You know, they're all valid, you know? And so navigating those fears is an important thing to address in your therapeutic sessions. Grief, you know, literally on a monthly basis, when a woman gets her period, she's going to go through a period of grief. It's a loss every single month, whether there was a chemical pregnancy or a miscarriage. It's almost the same, you know, like they go through grief and depression every single month. And then anxiety. It's super, IVF is a super expensive process without a guarantee. Like, it's an incredibly expensive gamble. And it's super anxiety provoking because it involves lots of injections with medications that we don't have all the answers on the side effects long term. There's also a lot of procedures that are done, but both diagnostically and therapeutically in the setting of IVF that can be traumatizing. There's also something to be said about things that doctors say to their patients in their bedside manner. Doctors have said deeply hurtful things to my patients. And that's another piece of trauma that we have to work through with them. And then on the flip of that, I feel like it's worth mentioning that, on this continuum of mental health, that, couples that have a long-term fertility struggle when they finally do fall pregnant, first of all, they spend that entire pregnancy anxious that they're going to have a miscarriage, or they're going to have a stillbirth, or their baby's going to have a medical complication. And then once that baby is here, happy, safe, and sound, they have a really hard time often enjoying postpartum, because anyone who has had a child knows postpartum is hard. Breastfeeding is hard. Lack of sleep is hard. Your body image stuff, hard. We're so focused on labor and delivery that we don't do much preparation for postpartum, and we don't have the social constructs to care for women in postpartum like we did when we were tribal creatures. And when we had families, expanded families within our own home. And so they fall into terrible depression because they feel like they should be more grateful and that they should be enjoying this time that they worked so hard to get to. And it's really not as pleasant as they thought it would be, and so then the mental health struggle continues. And now I'm super passionate about training mental health practitioners to fully understand the breadth of what this work what's involved in this work, so that you can walk alongside my clients, along with me, because they need both of us, because it's hard. There's nothing easy about a fertility journey.
That all resonates so much with me, as a parent and as a clinician who has walked with people in all kinds of different, parenthood journeys, whether that's fertility or adoption or, any of those things. I think, like, how could it not involve the normal human emotional experiences like grief and potentially trauma and anger and joy and worry. And so, yeah, I think that has to be part of, if we're talking about holistic, absolutely. And I'm so glad that you made this course too, because as I said at the beginning, we don't get trained on that, but there is a huge need. And so I'm curious if you could talk a little bit, just for our listeners, about what the course kind of entails, or kind of a little baby overview of what they could expect from it if they are interested in, like, really diving deep and getting educated in how to support folks going through fertility journey.
Yeah. And so, I think this is pertinent not only for mental health practitioners, but for massage therapists, for chiropractors, health coaches, anybody in the allied healthcare field, but also primary care doctors. And honestly, OBGYNs. It's shocking how little OBGYNs actually know about fertility treatment. And that's usually the first line of practitioner that a woman will see whenever she's struggling to get pregnant. And I've seen them muck up the diagnoses and treatment interventions over and over and over again. But so many, even in the Western medical field, just don't have that kind of fertility knowledge. And so the course that I built for you guys, for AIMH, offers basic knowledge on the menstrual cycle, on the different phases of the menstrual cycle, on the hormonal fluctuations, how to keep track of it, how to understand where the issues are, how to spot them. I don't address exactly how to address them because that would be my field, not your field. But I want to give you a basic understanding of how the menstrual cycle works because we were not taught that in health class. And then the second module dives into all the potential causes of fertility struggles. And we talk about things as simple as lifestyle factors. And then we talk about things like physical factors, hormonal factors. I go into detail about male factor, which I'm just going to, tiny little soapbox here, y'all.
Soapbox away. We welcome a soapbox on this podcast.
Yes, it takes two to tango, and it is well recognized that we are in what they call a spermageddon, and so semen parameters have plummeted worldwide over the past 40 years. And instead of addressing the plummeting semen parameters, they just keep lowering the standards. And so what was fertile 40 years ago, what was infertile, 40 years ago, is now considered fertile. And the reason for this is that in the treatment of IVF is treatment for male factor. Just FYI, it really doesn't increase female fertility. It just pulls her eggs out so we can diagnose whether we have an egg quality issue or not. And we could potentially get more from one cycle than we do in a natural cycle. But it doesn't increase her fertility. Whereas in IVF, they do a procedure called ICSI, which means that they pick the best looking sperm from their sample and they inject it right into the egg. So they can visually, and I guess there's new technology now where they're actually putting the sperm through like a little obstacle course. So they actually have to perform as well as visually. I don't know a whole lot about that, but I'm kind of excited about it. I know.
I'm sorry. I'm just picturing it. I'm sure it's not as cute and silly as I'm imagining in my mind, but
right.
That's interesting. Good to know.
Right. And then they inject it right into the egg. So the sperm doesn't have to do any heavy lifting, which I have thoughts about because there is natural selection and a chemical interplay that happens between the egg and the sperm that I believe is an important part of evolutionary biology that we're bypassing with ICSI. But nonetheless, it is the treatment for male factor because they can pick the best looking sperm and they can put it right into the egg. And so in my mind, before we go through an IVF cycle, then the man needs to do everything they can to optimize the DNA of their sperm. But often, if they have a semen analysis, and even if it's borderline or on the low end of normal numbers, they're told it's normal. And they can have poor morphology or motility, which is morphology is how they look and motility is how they move, and still be told it's normal because they're just assuming that these folks are going to go through IVF, which is a disservice, especially for folks that are just trying to get pregnant naturally. And so the man's left off the hook, which I am so not in support of. Even if there is a diagnosed issue, I have to push and push and push and ask for, a second opinion to get that man treated because they're just going to say, oh, we're going to, just go through IVF, which is $30,000 and the female is the patient. And then the other part of that is even if it's diagnosed male factor and the male has fertility coverage through their work, through their insurance, but the female does not, the male's insurance is not going to cover it. It's broken. It's busted. And it upsets me so much because the men are left off the hook. And so when a woman comes in and she's, here for fertility treatment, I ask for the semen analysis and I look at it. Don't tell me it's normal. Let me see the report. It's not normal. The vast majority of the time, 75%. Sometimes there are great numbers and he's off the hook. But they make 1,500 sperm every heartbeat. And so the ability to impact their semen parameters is higher than these eggs that we were born with and we, eventually run out of. Soapbox done.
I'm into it.
So, the last part of the fertility struggle factors is complex conditions. And so we look at things like endometriosis, polycystic ovarian syndrome, and autoimmune infertility, which is on the rise. And so after that second module, you really kind of have an understanding of the diagnoses your clients are coming in with. So they don't have to explain them to you. And then it should give you some hints as to if they're describing symptoms to you, directions you could potentially point them in to figure out for themselves. And or it's a list they can take into their OBGYN or fertility doctor and be like, check for all of these things before we go forward with the $30,000 intervention. And then the last piece is everything about the Western fertility intervention, starting from testing to low level interventions like medications you can take at home while timing intercourse appropriately, to IUI, which is intrauterine insemination, to IVF, which is in vitro fertilization, and then donor options. And so there's so much medical lingo and different procedures that I just don't want them to have to explain all that to you. And so you can refer to what's in the coursework to know exactly what they're talking about and let them just spit out their acronyms without backing up and having them explain. And in that way, I feel like you provide more solid support because they're not working on educating you. You've come into the treatment room educated and they can just share their experience. Now, for people that are on their fertility journey that you want to direct towards better information, I do offer coursework for people going through difficulty conceiving. My Wild Rose Woman program is a comprehensive, holistic fertility optimization program. Over 10 modules, they're going to learn everything they need to know to help themselves. They're going to learn about their menstrual cycle, how to take care of their menstrual symptoms naturally, including like products that I recommend. Not all are created equal. Just like the healthcare practitioners learn about other potential causes of fertility struggles, supplements they can take to promote fertility, dietary interventions. So many of us, I'm saying us because I struggle with this myself, but culturally, I think women struggle to feed themselves enough. We're kind of trying to stay thin and, getting all this fasting information and you just eat, eat protein for breakfast, first thing, 30 grams, and eat high quality food throughout the day. And don't, the focus is nourishment and nutrition versus starvation and lack. And it doesn't have to be perfect. I mean, I don't want you drinking sodas and eating fast food, but beyond that, I'm not a diet Nazi. I just want you to eat enough meat and vegetables to give yourself the nutrients to promote good egg quality and just general systemic nourishment. Another soapbox. Also, we'll talk about specific foods for specific concerns. So if you have endometriosis, you might consider doing this, or if you have PCOS, you might consider doing this, or if you have PMS, you might consider doing this. We talk about how to reduce toxin exposure, especially in your home, because that's really the only place that you have any kind of control. I go over fertility-friendly exercise. I offer fertility meditations. I have a whole module on the menu of self-care practices you can consider. And then, of course, the wild world of Western fertility intervention. And by the end of that 10-module course, you will be totally empowered to take your fertility journey into your own hands. And if you need additional assistance, then you know where to find me. I also have it bundled into a couple of different bundles in case you don't need all of that information. There's a self-care bundle. There is a bundle on diet and toxin exposure. There's one on fertility basics, like the cycle science and fertility foes. And then one on basically IVF prep. So if you're already on that pathway through the Western fertility intervention, you get all the information you need. Because I tell you, your doctor's not going to spend the time to make sure that you know all the ins and outs. And that's where the anxiety comes in. Like, did I do this right? Do I know what I did? And so having that information laid out clearly and concisely for you to refer to, I think is really, really helpful.
Before we move to our kind of how we love to end our interview podcast where someone shares a guided practice, can I ask, What is each one of ours biggest pet peeves in this topic area? I will start. Mine is when people say biological clock is ticking. Because remember how you were talking about how like that time, and that really resonated with me because that's what I hear a lot from people that are experiencing or that are in this path of like, oh no, I better hurry up. Like I don't have the money right now. My clock is ticking, and I'll somehow at some point like I won't be able to do this anymore. It's kind of true in some ways, but I don't know why that feels so old school to me. It feels your biological clock is ticking. I don't know. That's just one of my pet peeves in this area.
Shelby can maybe speak to the like science of it, but I think it's like from an emotional component. Like if we're trying to reduce stress, that's just like not going to do it. There are maybe ways we can think about it without phrasing it that way.
I think I'm going to stand with my patients here and say my biggest pet peeve in this process is the dumb stuff people say to you when you're trying to get pregnant, or even when you are pregnant, the unsolicited advice, which comes from a good place most often. But the words are often short-sighted, like just relax, it'll happen. Just relax is just not useful ever. Don't ever say that.
No, it's like telling someone to calm down when they're pissed. It's like, oh, just calm down.
Correct.
Chill pill.
It's inflammatory.
I'm relaxed now. Thanks. I hadn't thought of that.
Yeah,
yet.
That's right. That's all I needed. Thank you for saying that. I'm feeling better now. Right.
Yeah.
And offering, and I often say this to patients, it's like, well, they said that because that was their experience. They're just deflecting, on you what their experience was. But like, just do this or just do that. And instead just listen, just listen to their experience, where they're at with it, and say, that's rough. And, it sucks that you're going through that. I don't know what to say, but I'm here, if you need to talk. Well-meaning folks say really dumb stuff, because of lack of education around what these couples are going through. And it's hurtful, and it's unfortunate. So I think that's my biggest peeve. If you don't know what to say, then say, I don't know what to say.
Yes.
But I'm here for you.
Yes. Well, do you have one, Laurel, pet peeve?
Well, I think you all probably covered most of mine. I think I was mostly like the fact that we don't get educated on anything about our bodies at all. And the stuff that people say. One of my like life pet peeves just generally is when people say, or when people ask someone when they're going to have a kid or when they're going to have more kids. That can be within the context of someone going through fertility treatment or not. Like that is one of my general life pet peeves. So that one was covered. I think if I had to have a fresh one, and this is not like something I think that's ultimately immediately solvable, but is just like the enormous burden and cost, while also having all of these current, like, and again, in our social location, like political frameworks that claim to be pro family. And then just the exorbitant amount of both like financial burden and like lack of support when it comes to people who would really actually like to build a family in some way, whether that's through, fertility treatment or otherwise. So I think, just to, even if I knew kind of like generally that IVF, for example, is very expensive, but just like the amount of money that people have to spend is shocking. And in the face of all of these policies that are being thrown out there that are just like blatantly not pro family, in my opinion. But that could be a whole episode probably. So.
Well, thank you all so much. This has been a really good conversation. And I think it's also a great entryway into the courses that you provide because there's so much information. Like you said, we kind of just briefly dipped our toes into some of those areas, but the course has so much information and I found it super helpful. I learned so much.
Well, so, and a lot for those of us, for those listeners or viewers who have experienced our guest episodes before, we always ask if our guest has a practice to share or just something that would give us more of an active flavor of the work that they do. And so Shelby has a practice that we're going to get to clip in just a minute. Shelby, is there anything that you want to say to introduce it before we throw it up there?
Yeah, for sure. So, as part of the Wild Rose Woman fertility meditation module, I offer 4 different meditation techniques that include breath work and yoga nidra, which yoga nidra was the first meditation technique I ever learned. And I find it great for sleep. And then there's 2 Qigong techniques, which I really like Qigong. They're near and dear to my heart because they're moving meditation. So it gives you something to do with your body besides just, trying to watch your breath and not think. I like them better than trying to meditate to be. So within the program, I teach you a self massage technique, which I absolutely adore, and then the chi shower. And that's what I'm going to share with your listeners today. It's a quick energy clearing exercise that can really help shift your mood. It's kind of like burning white sage to clear negative energy from a space, but it's for your own mind and body, and it's scent free. So you can do it anywhere, anytime. It's just a quick and dirty way to just shift your energy. And I made a video recording and an audio recording of it, so you can see it in real time, but also be guided through it auditorially. And so I hope you guys like it. My patients have loved it as just a quick way to shift things.
Amazing. Okay. Well, before we get started, if you're listening on the podcast and you want to be able to watch it, just hop on over to the version of this that's on YouTube. But otherwise, enjoy.
A chi shower is a great way to cleanse your energy. Sweep the arms up over the head and imagine beaming energy down through the top of your head and slowly through every inch of your body, coming down through the front of the body, the torso, the legs, bending at the waist, sweeping back to the back of the body, keeping the hands about 6 inches away from the body. And once you get to the low back, we'll wrap around to the front of the body once more, sweep down through the arms, and bring the energy over our head, and begin again, scanning down through the body, the chest, the belly, the thighs, the shins, feeling the energy coming from your hands into your body, coming up the back of the body, up through the thighs, the buttocks, the low back, transitioning back to the front of the body, beaming chi through the chest, the arms, and sweeping over the head and coming down the front of the body once more, the face, the chest, the belly, the groin, the thighs, the knees, the calves, the feet, and bringing the hands up the back of the body slowly until you reach the low back and coming forward to the chest, the shoulders, the arms, sweeping back over the head and coming down the front of the body, cleansing your aura, cleansing any negative energy, releasing anything that doesn't serve you. Use this energetic shower to shift your mood, shift your body. Slowly paying attention to every little part. And once it is complete, you bring your arms through heart center. Take a deep breath. And we will do that facing the front so you can get a perspective from both sides. Sweeping the arms up, beaming energy into the top of the head, coming down the front of the body, bending at the waist, coming all the way down to the feet, and beaming chi into the back of the body, until you come upright again, cleansing the energy in your arms, in your head, in your face, in your chest, bending at the waist, keeping your hands about 6 inches from your body, cleansing all the energy, all the built up emotion and tension and anxiety. Cleanse your shoulders, your elbows, your hands, coming up over the top of your head and back down the front of your body. Breathing, releasing, sweeping over your feet, up the back of your legs. Beam good energy into your back, releasing tension in the shoulders, up over the head, the ears, chest and armpits. And you can make this as slow or as quick as it feels good to you. This is your time, your body, your chi shower. And it's such an excellent way to get an attitude adjustment. And once you feel complete, bringing hands through heart center.
If they want to learn more about working with you or like the services that you offer?
Sure. I can be found at wildrosewoman.love. And I do offer, in-person sessions if you're in my geographical area, but I also offer online health coaching and fertility coaching if you need that kind of support, even without the physical medicine of acupuncture. And I've worked with other acupuncturists in other areas, sharing my treatment plan, guiding their patients when they don't have that fertility knowledge. Acupuncture is acupuncture. And most of us have some degree of understanding of where we should be doing acupuncture for fertility, but it's the whole fertility coaching piece that's really missing from a non-fertility specialist acupuncturist practice. I want to, remind folks that, fertility is more about body awareness and deep nourishment than it is about doing all the things, being all the things. It's more than just your ability to conceive, it's your ability to receive safety and softness. It's literally a miracle. Anyone gets pregnant. The conditions have to be absolutely perfect. And you have an incredibly small time each month to get that job done. And so give yourself grace. I wish all of you the best of luck with your journeys, both supporting your clients and for those of you that are walking the fertility journey. And I'm here to support you in any way that I can. And I really enjoyed talking with you ladies today. It was super fun.